active range of motion exercise, not an isometric exercise. And what I want you to do is I want you to bend your knee, sliding your heel up to your behind, and now straighten, moving your heel away from your behind. Okay, so one more time. And sliding it. Now, if she were to have shoes on, would that make it more difficult for her? Okay, it would provide a lot of friction too. Friction provides resistance. It also can cause a pressure sore, so we want to avoid that. Having socks on is a good thing. We can also put her leg in a bag, plastic bag, to reduce the friction. And now slide your leg up and back. Just a way of reducing friction and resistance. So if somebody's very, very weak, they may not be able to handle that resistance. And of course, you use one that hasn't been used. Okay. So the next one is ankle pumps and ankle circles. Okay. So one of the things, what did we talk about when it came to bed rest? What was one of the problems with bed rest? Pressure sores. I'm sorry? Circulation. So DVTs. So clots, thrombosis. So one of the things that is a precursor to that is pooling of blood in the distal part of the extremity. And so what normally we do to pump the blood back to the aorta is that the gastroc, huge muscle, actually works as a muscular pump. So we want to activate the gastroc, soleus complex, to pump blood back to the heart. And so what does the gastroc do? Points the toe. Okay? So we call these ankle pumps. So somebody comes out of surgery, and what does the nurse say? Pump your ankle. Move your foot up and down. Okay, and that's to help prevent DVTs. So, point your toes like you're stepping on the accelerator of a car, and now bring your toes towards your nose. And point your toe, and bring your nose towards your toes toward your nose. Nose toward your toes, okay. Point your toe like a ballerina, and now bring your toes to your nose. So 10 reps of that. And also, oftentimes, do more than 10 throughout the day because you want to prevent the buildup of fluid. Okay, so another thing we can do are ankle circles. Okay, and so you're going to point your toe, moving up and around, and now go in the opposite direction. Okay, and these are ankle circles. So then we can activate the perineals and the tibial muscles. Okay, and then, so ankle circles one way, then the other way. Often patients have difficulty coordinating, doing them both at the same time, so it's probably best to do one and then the other. Okay, patient gets really bored, you've been doing these forever. Have the patient go through the alphabet. So can you write an A? Okay. So, little creativity there. Write your name. Write the names of your grandchildren. Write your address. So, a patient can do this while they're watching TV and be helping themselves as well. Okay, so those are ankle pumps, ankle circles. Hip abduction. Okay, so moving the leg out, sliding the leg along the side of the bed, out and in. And out and in. So, as she gets here, she may not have the strength to hold her leg up. So you may be having to hold help. So that could be what we call that active assistive range of motion. Or you're on the big blue mat in SLL, big blue mat. Patient should be able then to slide all the way through without you having to hold. So I can maybe have hands move over a little bit. Okay, now slide her leg out. Okay, again, a lot of resistance, decreased friction. Put her leg in the plastic bag. And now slide it out. Okay, so that's hip abduction. Okay, so the next one is called short arc quads. And could somebody pass me the towel, please? Okay, so let's say I forgot to bring a towel. Free ride. Let's say I forgot to bring a towel. What I could do is I could put my arm underneath, and what I want you to do is tighten up this kneecap, and your foot will kick up. Okay? So tighten up this muscle. Or I can say push your knee into my arm. So, is this isometric? No. Why? Extremities moving. Okay? So this is, notice that we don't have a lot of range of motion. It's a very short arc of motion. Hence, short arc quads. All right. Now a long arc quad, I'm going to have you sit on the edge of the mat. Okay. And out a little bit. And she can kick her leg straight. And now bend it. Straight. And bend it. And notice now we have a longer arc of motion. And we call that long arc quad. So short arc quad, long arc